I usually hold back from making videos like this because I know the eventual outcome will be people are going to say he's an ER doctor, therefore he has credibility with stats and governmental policy, which simply isn't true. Half the stuff he says in this video is complete disinformation, and I'll show you what contradicts it and why he's wrong. And by the way, just to be clear, nothing I say here has anything to do with him as an ER doctor. I'm sure he does absolutely great work for people. I do agree with him that schools should be reopening where I'm from. It's central Pennsylvania, an area with low population density. The virus has not been able to spread that greatly here. Schools should open with safety precautions, but it shouldn't be done with disinformation or misinformation. We have to make sure we have the facts 100% straight, and he just isn't giving them to us. People are going to watch this and listen to him because he's giving them the information they want to hear. People here are very conservative. They want to believe the virus isn't that big of a deal, when in reality, it is a lot bigger than he makes it out to be. So I will show you where he's wrong.
Hello, my name is Lenny Gessner. I'm a father of 3 Northumberland Christian School graduates, and I currently serve on the board at NCS. I'm also an emergency physician, and I've been practicing at Evangelical Hospital for the last 34 years. Prior to that, I did a residency in emergency medicine at the Geisinger Medical Center. I've been asked to share my opinion on the current virus pandemic, and specifically as it relates to school attendance and safety measures at school. My opinions are going to be based on my 37 years of experience, my research into the virus, since we in the emergency medicine field were on the front lines of this whole thing in the past 3 to 4 months, as well as my experience with the virus pandemic of 2009, as an interesting contrast to how we're handling this situation.
You're going to see that he really doesn't understand what happened in 2009. He's either being dishonest about what he says later, or he doesn't understand enough. The numbers literally do not add up in any way.
I want to say that I'm sharing my personal views, and I'm not acting as a representative of Evangelical Hospital.
And it should be on the basis of personal views, because being a hands-on worker in an ER, an emergency physician, does not mean you have a license to talk about stats or governmental policy.
I thought I'd start with Virus 101. The pandemic we're currently dealing with that has affected virtually the entire world is caused by a virus. It's not a bacteria. So there's no specific treatment such as an antibiotic, such as penicillin or something like that. It's commonly called COVID-19. That name comes from coronavirus is where we get the CO. Virus is where we get the VI. D stands for disease, and 19 is the year of emergence, therefore COVID-19. You might have also heard it called coronavirus, and another name that's been used is SARS, CoV-2, but they're all referring to the exact same virus. There are other coronaviruses that affect humans, and we've been dealing with pandemics probably forever. The most recent pandemic we dealt with in the United States was in 2009, the swine flu pandemic. There was a pandemic in 1968 called the Hong Kong flu. In 1957, the year I was born, there was the Asian flu. And the worst pandemic in the last 100 years or so was the Spanish flu back in 1918. Some of you
That's all general information, so that stuff is correct.
Spanish flu back in 1918. Some of you may remember the swine flu, or maybe you don't, because not much happened and nothing unusual occurred as far as response to that pandemic. So the question becomes, why is the response to this pandemic so aggressive and so different and unusual compared to the previous pandemics? Well, there's a number of reasons why. Number one is it's a new virus. You might have heard the term novel used to describe this virus, and all that means is it's never been seen in humans as a cause of infection before. So the concern was that everyone was potentially susceptible to this virus. There was no natural immunity from previous exposure. We've learned now that that may not be true, that there may be individuals with immunity. It's probably through crossover reaction to other coronaviruses. I've seen numbers perhaps as high as 50% immunity. So there probably is, in fact, some immunity out there. The other thing that happened was models started coming out predicting large number of deaths from this virus. The one that had a lot of influence was a model from England, the Imperial College.
Now, he's never going to note that all these models are saying what the death toll would have been if we didn't do anything, like lock down the entire world to prevent the spread of the virus, but he never mentions
College
that.
of London. And they came out predicting 500,000 deaths in Britain and 2.2 million deaths in the United States. And health officials
And that's what it would have been if we didn't do anything to stop it.
in the United States, including Dr. Fauci and Dr. Birx, who've played a big part in the task force, publicized these numbers. And although within a relatively short period of time, 3 or 4 weeks, the Imperial College kind of lowered their numbers dramatically.
So why would the estimates lower when the higher estimates are publicized? Why? Why do you think the estimates lowered after people got scared because they knew how many people would die if we didn't do anything? See, this is a dishonest misrepresentation or dishonest representation of what actually happened. The models adjusted based on what people were doing as an action to combat the virus.
That didn't get as much attention. So in fact,
Not as much attention.
500,000 deaths in Britain were reduced to an expected 20,000 deaths. And there was a similar reduction in the expected deaths in the United States as well. At about the same time, the World Health Organization was reporting the mortality of this virus as 3.4%. As comparison, the regular flu is typically about 0.1%. But early in a pandemic, the death rates are going to seem higher because you're dealing with more severe illness presentations, the sickest people, and those who are.
The death rate, even right now with advanced testing in the US, is above 3%, which is still 30 times higher than the flu.
Aren't as ill or maybe have virtually no symptoms, aren't showing up or aren't being counted. And so almost invariably the death rate declines from the initial reporting. And in fact, that has happened with this flu as well, with this virus as well. The death rate now is certainly under 1%, and it's probably in the 0.26%.
That's not true at all. When he's talking about death rate, he's talking about deaths divided by population. You're going to get a really low number when you do that. If you take deaths divided by actual cases, then it's above 3%. This is another dishonest representation of the facts.
Range. The other factor that played a role in our response was there was a group in early April called IMHE from Washington State, and they were putting out models on anticipated hospitalization usage, ICU bed usage, ventilator usage, things we've probably all remember hearing about. And they were predicting that our healthcare systems were going to be overwhelmed, and hence the need to flatten the curve, another term we've probably all become familiar with. As it turned out, these models ended up being grossly inaccurate.
New York had one of the worst public health catastrophes in American history. Florida's going through it right now. Texas has gone through spurts. It comes down to populated areas versus the capacity of the medical system in that area to handle cases. Of course, in our bubble in central Pennsylvania, we didn't get the virus in a bad way. That is what makes sense. And by the way, as an ER doctor, please don't minimize a crisis that is causing so many other ER doctors around the country to do things like commit suicide and suffer under tremendous mental health straining. I know you aren't dealing with it, but other people are.
As well, but nevertheless, these factors were the impetus for the lockdown of the country and the strategy that has never been tried before. Now, I don't want to.
He's like, wow, this has never been tried before. I wonder why we locked down the country. Maybe it has something to do with the early models.
Poo-poo the dangers of this virus, because it certainly
he doesn't want to suppress the dangers.
Can be dangerous and has been dangerous to a lot of people. There are a lot of deaths from the virus. It's been estimated as 130,000.
Now, this was weird to me.
As of the most recent count.
Like, this must have been recorded a couple of weeks ago or something, because the death count is at least 160,000 now, if I'm right. Yeah, so the death count right now officially is 163,000 total, And the numbers have stopped going up as fast once the White House started recording the data instead of the CDC. So we don't know what the actual count should be right now officially.
I'm not sure I believe these numbers entirely, as at least early on they were adding in suspected cases as opposed to proven cases.
This argument is completely wrong. It was a theory from the start that had a little bit of credence at a very minor level. Very minor level. There is not a lower amount of deaths than reported. If you look at the actual charts of deaths in the United States, this is so right here is below normal per the year average. This is above normal per the year average. So unless if some magical force swept through and killed people along with COVID-19, then the COVID-19 death count is probably more than they have recorded. Unless if there's some other magical factor. Deaths have gone up that are not COVID-19, things like suicide, things like gun violence, those things have gone up. Things like overdoses, they have gone up as well, but not enough to explain the change, this huge spike that just happened right here when our hospital systems became overwhelmed by COVID-19. So what he's saying here is completely untrue, and it's based around conspiracy theories. It's not true in any statistical sense imaginable.
And they're also, for the most part, counting anybody who dies with coronavirus, a positive test, as being the death from the coronavirus, whereas in fact a lot of people are dying from their underlying illness, such as heart disease and things like that. Regardless.
Oh yeah, I don't know anyone with heart disease, diabetes, who is a cancer patient, who has an autoimmune disorder. You know, that is not only a pretty high percent of the population you're kind of downplaying.
It's not an equal opportunity danger.
Equal opportunity
danger. The vast majority
danger.
of the deaths from coronavirus are in the elderly. 80% of the deaths are in individuals over 65.
True.
And the average age of someone who's died from the virus is about 80 years of age.
Yep, true.
Now let's compare that to the 2009 swine flu pandemic. Now, there were certainly less deaths, and the estimated number from that pandemic was about 12,500 deaths.
True.
Although, interestingly, the number of cases in the United States was estimated at 60.8 million people infected.
It wasn't a big
deal. But again,
deal.
the death rate was substantially lower. However, of these deaths, only 13% were over 65. So the vast majority were younger people. The young were very hard hit. The average...
Okay, I hate this point, because if you look at the total numbers for people that died from H1N1, of course he's correct. 12,000 total died. If you want to go to a calculator and take 160,000 total dead that we have already and compare it to that, when you talk about, he's going to say that this isn't a big deal for younger people.
The average age of the swine flu victim at death was age 41. Now let's look specifically at children and COVID. Because the COVID risk to kids is incredibly low. The last numbers I saw, and this was from maybe 2 to 3 weeks ago, there was an estimated 30 deaths in...
Even at the lowest estimates, with the entire country shut down, Corona has been far worse for young people than the swine flu ever could have been. Minimizing Corona by comparing it to the swine flu is one of the most anti-intellectual things I've ever heard when, discussing this virus. And I hate disinformation like this.
In children, kids under age 18, obviously tragic. And yet the regular flu this past year killed an estimated 166 kids under age 18. So the regular flu was 5 times as bad as COVID this past year.
I remember when we shut the whole world down for the flu or H1N1. Remember when the entire world was shut down for those viruses? Because I tend not to. And you're saying Corona hasn't been bad for kids. But when you talk about a year's worth of death versus 4 months worth of death? And you're going to compare those numbers like that makes any sense? It's not right.
2009 swine flu that I already mentioned was very devastating to younger people.
No.
Was responsible for 317 deaths. It was 10 times worse than what we're dealing with the COVID.
It's not accurate.
So again, to the overall population, the COVID pandemic is worse than the flu. but it's not as severe as the flu in those under age 18. So with this information, what can we say about schools? Is it safe to return to school? And I would say emphatically, yes. We deal with the regular flu, and we dealt with the previous swine flu pandemic without any, again, both of which were more dangerous to children than the coronavirus we're dealing with now.
This is all simply not accurate.
And we did that without any significant disruption to school. Now, I realize some people would say, okay, the kids might be safe, but what about the risk to teachers? Maybe that's the real danger. Because, in fact, obviously they're a little bit older and maybe they have some risk factors for the disease.
Just a little bit older.
There's very little evidence that asymptomatic students are significant spreaders of this virus.
That's an actual argument.
To be honest, a teacher's more likely to catch the disease somewhere else, Walmart, a restaurant, something like that. Europe was hard hit by this virus as well. Spain was. In Italy,
here we go. Here we go. Let's compare the U.S. to countries who have like 5 cases a day.
Hard hit. But they're now aggressively reopening schools. Denmark.
Wow. I wonder why. I wonder how these countries get to reopen their schools. Wow. How do these countries get to reopen their schools, but we can't? I don't get it. If only there was a Google search you could do to find the correct information for your evaluation. I don't get it. Why? Why would this country have more issues opening schools than this country? What? Makes no sense.
Austria, Germany began opening their schools in May.
Germany?
They haven't seen any significant increase in cases.
Dude, I swear to God, like, he has to be memeing me right now, dude. This is daily new confirmed COVID deaths per million people. Per million people. So it's added for the size of the country. So people can make the argument there's less dying and less cases in other countries. But these countries also have much lower populations. But even when you extrapolate that data to make sense for the U.S., we are such severe outliers. We're doing such a bad job handling this virus. And there's another graph I could pull up that shows actual cases in countries. I can't find it right now. There's Kanye, there's Obama, whatever. But I'm sure you've seen it spread around Facebook. It'll show like Germany with 300 new cases in a day. New Zealand just got their first new case in like 102 days. If you type in New Zealand Corona, I'm sure it'll be somewhere right here. So COVID, first case in 102 days. These countries can easily open up. When you have a country with 70,000 cases a day versus a country with 50,000 cases a day, the discussion is totally different. And again, I agree with opening schools in my area because my area is a low populated area. There's low community spread. Barely anyone here has been affected by it. If you open schools with safety precautions, you should not have an issue in this area. Although, we still probably will.
In fact, they've gotten to the point now where they're starting to dramatically relax the restrictions, such as social distancing and masking. For example, Belgium dropped social distancing.
There's no cases there, and everyone in America is too selfish to wear a mask because they want to believe freaking Facebook meme conspiracy theories.
Completely in younger kids. France, that at one point, when with their kids in school, was I think recommending 9 or 10 feet distance, are now saying 3 feet distance of social distancing. Masks are now optional in Denmark, Norway, the United Kingdom, Sweden. Germany advises masking.
Those countries combined have less cases than my left toenail, dude. It's not a comparison. Those countries literally have 50 cases combined that he just listed off.
Always.
A day.
So I think we can certainly resume school. We can look at some of the guidelines from Europe as they've already gone back to school. I think we need to consider the CDC guidelines and consider what the Department of Health is telling us, but use these as a guidance for getting our students back to school. And I think we can do this with minimal risks to student and minimal risk to staff. Would I let my kids go back to school?
Would I let my kids go back to school?
Environment? Without a doubt.
Yeah, we know.
Have no problem
we know.
whatsoever.
We know.
So I hope this information has helped a little.
I hope this information that is false has helped you. Like, it's great to have your own opinion. It's great to make your own evaluation based on data. But please just go on Google, type in total cases, total deaths, type in the same thing for, school outcomes in France. See how they're handling it. See how other countries defeated this entire pandemic. because there are certain steps to take that the US has been unwilling to take. Do your own information and make your own opinion based around the actual facts. Don't just listen to somebody because they work in an ER room. Don't just use that, and he said a bunch of qualifiers like being a Christian and 37 years in an ER room with hands-on medical experience. None of that qualifies you to evaluate data, to evaluate statistics, and evaluate governmental policy. Because as you can see, he doesn't really have a good grasp on how all this stuff is interconnected, on how data is recorded, and how it all works. So I please want you to have your own opinion on this. I agree, schools should be reopening, but we can't keep on living in this fantasy world of false data. And just because one doctor from an ER comes out against consensus doesn't mean you believe everything he says. I could find you a nutritionist that recommends eating McDonald's all day. I could find you a climate scientist that says dumping oil in the ocean is a smart idea. An environmental scientist, whatever. Or, spraying up gas into the air is a good idea. I could find you those people. I could find you someone who is against consensus and everything. But you should agree, most likely, with 99%. If 99% of doctors agree on something, that's typically the right thing. But, of course, in an area like mine, very conservative, people want to open schools stronger than ever before. They want their football season, and I understand that. I understand why that's a great thing for this area. It's something this area relies on for pride, entertainment, and for happiness in general. Keeps the morale up, and those are great things to have. It's something we should push for. And in order to achieve those goals, we need to make sure we are basing our decision-making process off the actual data, which is why it's so important to make sure we have the right information.